And our first speaker is Dr. Ginny Creasman. She's been with us as a speaker at several of these summits in the past, and we're very happy to welcome her back again this year to be able to speak with everyone. She is the Medical Center Director at the Ann Arbor VA, and she's been in that position since February of 2018. She's been the recipient of several prestigious awards in the VA world. She's received the Federal Service Excellence Supervisory Award, and she's also received the Secretary of VA's Hero Award for her service to veterans following Hurricane Katrina. And she also has degrees from both the University of Kentucky and Morehead State University. And so we'll allow Dr. Creasman now the opportunity to provide all of us with some updates on the VA healthcare system.
First, Jim, I'd like to thank you for inviting me to have this opportunity to share a little bit about the VA Ann Arbor healthcare system. Again, my name is Dr. Ginny Creasman. I am the Executive Director of the VA Ann Arbor healthcare system in Ann Arbor, Michigan. And just going to the first slide here, I just want to just show you our facility there. And also, over this past spring and late winter, we actually went through a surge of patients that were ill. And we did a lot of things to help and support them, but also to help and support our employees. And so there you see a nice display called Heroes Helping Heroes. In addition, I'll draw attention to the logo. It says Moving Forward Together. You know, as we come out of our first COVID surge, we've actually been put together a program called Moving Forward Together, that allows us to keep a lot of the things that we learned during this past few months, but also bring forward some different ways of doing business in order to meet the needs of our veterans. So I'm going to go to the next slide. So I'd like to just start with just sharing with you about how the VA and the VA Ann Arbor healthcare system is provided support to our veterans, those with and without COVID, over the last 6 months, and also a little discussion about our fourth mission. So up to date, probably up until July, the VA Ann Arbor has treated about 142 veterans that have tested positive. We have actually 110 of them have fully recovered. We have, in any given time, several that we're monitoring and supporting. And unfortunately, we did lose 16 veterans. But overall, we did a very good job in managing the patient population. We learned a lot, as many did throughout the country, and we are applying them as we move forward. In addition, because we did such a good job of getting prepared to meet the needs of our veterans, we were able to lean into our community and support about 31, actually a total of 36, but 31 positive COVID non-veterans, in addition to our veterans. So that was good because, as you know, employees in our community is important to us, and if we have the opportunity to support them and still provide the support to veterans, we wanted to be part of that. Unfortunately, though, those 21 of those went on to do very well and recovered and are no longer actively being monitored at the healthcare system. Unfortunately, we lost 10 of them. We, again, same situation with our veterans, always trying to figure out how to create a positive and supportive veterans and non-veterans. And hopefully moving forward, we've learned a lot and we can keep creating that change. Just to be fully disclosed, the VA Ann Arbor healthcare system has had about 55 patients that have tested positive, at least that we know, of employees. And of those, 53 employees have fully recovered. And that we are very thankful for that, because these are the folks that help us to meet the needs of our veterans every day, and them being healthy and strong is important to us. We have 1 or 2 at any given time that are being actively monitored at home, and unfortunately we did lose our first employee in March, and that was a bit of a sad day for us too. So we, again, continue to learn, continue to implement, and support not only our employees, not only our veterans, but also we help support the community. So it's a little bit of a history in case anybody ever asks you what our role has been up to this date. But going forward, it has a little bit of uncertainty to the future, right? So we keep hearing, what you see there in the orange is, what has happened, right? The large surge in cases and the managing them up and then going towards the tail. And then that's great. And we were able to manage through that. We were able to do it safely, effectively, with enough resources to meet the needs. But we're also looking at what we refer to, what's the future look like? Is it going to be a second wave, as it did played by the blue line there? Are we going to see a huge surge in the fall? That's the big conversation this day. Or are we going to see maybe a big wave and what we call an oscillating wave of COVID patients? And that's the kind of ups and downs over a period of time. It still remains to be seen, but I will tell you, we are preparing. Either way, we're preparing to meet the needs of our veterans moving forward, however this disease comes back and however it impacts us. So that's actually starting today. So we're actually, just to kind of give you an idea of what we're working on, right now we're well positioned to advance our work in recovery. So we have right now, as we're knowing that the surge is coming and that we might have some issues, we're still in what we call recovery phase here at the VA Ann Arbor healthcare system and at all the VA facilities. And we are actually put a lot of pieces together just to support our veterans going forward so that we can meet their needs. We think there's been some deferred care that at the time was all right. I can go a couple months without a teeth cleaning, or maybe that pulled tooth is not hurting me at that time. But eventually it's going to hurt me, or I'm going to need to get those teeth cleaned. So we need to position ourselves so that we can bring those veterans in and get their needs met effectively and safety. So I will tell you, we have a very strong position when it comes to personal protective equipment. We have about a 60-day supply, and our intent is to keep it at that level so that we can be prepared to meet the veterans' needs. We have good testing capabilities here at this facility. We have like 3 different testing forums. It allows us to test for patients that are being admitted to the hospital, patients having certain procedures, and of course those that present with symptoms that are ill. So we are working to keep everybody safe. We have, again, strong processes in place to protect our veterans. If you come to the facility right now and you're seen in any one of our facilities, including our offsites, you're expected to wear a mask for your safety and our safety. You'll see our clinicians in mask, and all our employees in mask, and all of our clinicians are folks doing face-to-face care with mask and face shields. Again, just to keep everybody safe. And we are consistently, like most of the other healthcare systems, we see this as a window of opportunity, and we're operating at about 100% pre-COVID capacity, which means we are bringing in veterans. We've always seen about 80% of our veterans from the virtual care capacity in primary care, about 90% from a virtual care capacity in the last 6 months for mental health. And what it had really had gone down to a low capacity, it was our specialty care, right? Procedures and surgeries and things like that we've kind of postponed. We're up fully running. Our ORs are up and running. We're doing procedures. We still have our virtual first model, which is if there's anything we can do for you virtually first, we're going to do it. And if there's some things where there's a procedure and you have to come in, we're going to make that happen too. So just letting you know, we're now up to about 100% of our primary care and mental health and about 80% of our specialty care as we were before. And we've also brought in our learners back into the healthcare system with our, with our affiliations with the University of Michigan and other universities. We are actually bringing our learners back to the table and in support of our veterans. So I just want to share with you on the other side here is our visitors guidelines. They're always changing, but based on what's happening out in the community. But I will tell you at this time, we are really trying to limit the number of visitors. If visitors come to visit our folks in the inpatient setting, we're actually going with one visitor for a short period of time. If they're coming to support a veteran, where like say my veteran needs somebody to hear for him or something like that, then we're asking to make arrangements. But if not, then we're asking folks to please come by themselves. Again, just in support of keeping everybody healthy and strong. What are some things that we're planning on in the future so that we can meet the needs of veterans wherever they might be here in the Michigan market? Well, we're actually in the process of expanding our ICU. We have a new state-of-the-art ICU coming on this month, and it'll be fully operational in the month of September. That's great, but we at one point we were going to close the other ICU down. We feel as we work through this surge, next surge or potential surge, that we need to have all the resources available. So we have an extensive ICU expansion plan going on. It also supports other ICUs. Additionally, we are hiring about 60 ICU nurses or nurses in the community. So if you have folks that are nurses, or as you can see here, EMS or housekeepers or medical support assistants, If you go on to USA Jobs right now, we have several job postings out there. And we do this for two things. One is to prepare for the future. In the event that we do have a surge, we want to make sure we have enough housekeepers to keep the place clean. We want to have enough ICU beds and employees to take care of our patients, whether they be COVID or non-COVID. And we need folks to answer our phones and to make appointments and listen to our veterans. So we almost have up to 200 positions that are on USA Jobs, and we're looking to hire. So that helps with our search. The other thing that it helps us is that, many of the healthcare systems in the community are actually doing reductions in force. They've been hit hard financially. Melissa asks us to work with our colleagues that are strong and bring them into our healthcare system in support of veterans here and then also in the community if we get called upon. We're working on some other projects that we realized through this process. The scheduling has been difficult and a bit of a struggle with all the different VVs using the virtual care environment or the face-to-face. So we're working on a modernization of that. We also hired what we call a geek squad. With many folks, the system is not always the VVC appointments, the veterans visits appointments are not always easy, and we need to move away from the telephone. And we want to be able to see folks if they're going to do a virtual appointment. So we're hiring about 10 individuals there that will not only work with our providers and teaching them how to use the system and fully implementing and being more available and stronger with our virtual environment, but we're also hiring folks that will go out and help and support our veterans in that process too, because many times that's the limitations are is they might not have the right equipment or know how to get onto their first appointment and stuff. So we're actually working to have a two-pronged approach to help veterans going forward. We've done a lot of market-based collaborations. I would say as of today of me recording this, we actually have moved our CLC up to Saginaw, and they've been very supportive of us, but because we had to expand in our acute med surge and to meet the needs of our veterans. And we just continue to work together to support each other. I will tell you that a small portion of our CLC will be coming back online next week. It'll mostly be doing a lot of rehab care. And we'll still be working with our community partners and our VA partners to support each other as we work through the next few months. Some of the recovery work we're doing, I just want to let you know, we're working on being a comprehensive cancer center with navigational support and kind of a hub. That means we're going to be like the hub for the whole state of Michigan. You come here, you can get your comprehensive cancer care. We have a virtual component. We'll have a center of excellence, and we'll be able to support our veterans moving forward. We have expanded our surgery program, and we're working on, we had 7 operating rooms. We're working on an 8th operating room, hired some additional neurosurgeon time and orthopedics time so that we can meet with our needs of our veterans in those 2 areas. We've also started a comprehensive pain and integrative medicine program. We've always had this kind of East meets West. We've always had of course, the medication and the pain implants and all those different things that manage veterans from a kind of a medical approach or a Western approach. And then we have this kind of Eastern approach, which is our whole health implementation of, biofeedback and TENS and acupuncture and chiropractic care. And we've actually brought them together and integrate them so that we can make better decisions working with our veterans and add a broader resources that help manage pain and recovery moving forward. And we've also invested in our admissions and transfer operations so that we still have veterans that want to come to us that are out in the community, and they often don't know how to get here and how to make those dialogues and conversations. So we have a group of folks working together on that. So again, a lot going on here at the healthcare system, fully operational, and looking forward to continue to meet the needs of our veterans, even as the landscape is changing out there. A couple things that I just wanted to share going forward that Congress there's actually, they're thinking or they're put forward a request and sponsored a bill to name the healthcare system, not the healthcare system, but at least the facility here in Ann Arbor, the Lieutenant Colonel Charles S. Kettles VA Medical Center. And of course, a lot of folks know about Lieutenant Colonel Kettles. I had the greatest opportunity of meeting him when I first came back here in 2018 or 19, and he was just a bundle of joy. But he, of course, he's received the Medal of Honor from President Obama in 2016, and we're looking forward to have such an honor of being named after Lieutenant Charles Kettles. So just wanted to give you all a heads up that that's out there. We're really, truly looking forward to this, and hopefully it'll make it through the congressional hoops here in the near future. Additionally, when I was talking a little bit about the cancer care program, one of the things that allows us to be a center of excellence there is we actually have our first Fisher House in the state of Michigan. I think Detroit will be having one coming on in about a year, but we have our first one. It opened up June 1st, and I can tell you it's marvelous inside. It's a marvelous space, marvelous place. Has a lot to offer to our family members. So, and it's already seen well over 100 families, and those families have come from all over Michigan, Northwest Ohio, Indiana, Colorado, and Florida, just everywhere. And the average stay is about 2 or 3 days, but we've had a couple folks here for a few weeks. And I need to tell you that having this house and the ability to support our veterans has gone a long way. I got a lovely letter from a lady who was just thanking us for having the Fisher House because she had brought her veteran here to get health care and services, didn't realize he was going to be admitted, didn't know how to get back and forth from where she had come from. It was a long distance, and really thought that she was going to have to sleep in her car. And when she found out we had this and she stayed, not only was it a blessing and a place for her to stay, but she said she'd never stayed in such a nice place before. So again, if you have the opportunity, just know that this is one of the services we can offer to our veterans, and helping their veteran and their families be supported during times of healthcare need. Just to talk about a little bit in the future, this is the Canton CBDC. It's actually probably most likely going to be in 2022, probably late 2021 or early 22. It is going to be located in Canton. It's a 3,700 square foot facility. It'll have a primary care, virtual care, mental health services, and then as you can see, as expansive as it is, we're looking to see about having some of those complementary alternative services such as yoga, tai chi, and other items to meet the needs of our veterans in that area. We think this will make it be a lovely place for the veterans that are kind of, there's Ann Arbor and there's Detroit, and this is kind of halfway in the middle. So we think it'll serve a good growing population of veterans in that area and meet their needs closer to home. And we're just really looking forward to it. Groundbreaking has begun, and they have started clearing the spaces in preparation for building this area. So just wanted to share with you, these are some of the renderings of what the facility is going to look like. Also, I wanted to let you know that the VA has started an endeavor where they are doing what we call an as-built. And as-built, when you look around, there are pockets of places where we don't have good coverage for primary care and mental health services for veterans. And so a couple years ago, the VA endeavored to perhaps work with, local healthcare systems or office spaces and stuff in order to create leases where quickly you can move into a space that's already built, as built, maybe add some IT and a couple of things you need for taking patient care, but you didn't have to do a lot of renovation or build a CBDC like we're doing in Canton. So we actually have been approved for 2 of them. The first one is in Livingston, and the second one is in Lenawee counties in Michigan. And this allows us to meet the needs of our veterans in those areas. They're small, going to be probably most likely in partnership with other healthcare systems that are out there that might have some free space, not free space, but open space. We'll do a lease with them, and they're meant to be there for about 3 to 5 years in order to support us going through the other pieces that we might have to go through in order to get a building or a lease out there. I'm really looking forward to it because I know that especially the folks in Livingston and Lenawee, they've really wanted to have some of their own services closest to home. And this will allow us to essentially meet those needs hopefully quickly. I'm hoping within this next year or maybe even the next 6 months, make a presence in those areas in support of the veterans. So both clinics will offer primary care, mental health, and also virtual care, at least initially. I already alluded to it, but we have a new state-of-the-art ICU that's coming on. It should be actually, I think we're going to get it turned over to us in a week or two, and then we'll do the preparation and get ready to go, and then we'll be moving all of our patients into this ICU. The older one will probably do some touch-up, and again, prepare to have that ready to go into the future, because we just think anymore, if we're going to have this COVID and still need to treat patients that are non-COVID, that we have to create safe spaces, and we're just really looking forward to having this opportunity. So that's our new ICU. Unfortunately, I won't be able to do a grand opening simply because I can't have those many folks in the area, but we will do some type of virtual tour just to show folks what we're working through. The other thing too is right now, if you come into the healthcare system here, in particular the Ann Arbor site, you'll see we're doing a lot of upgrades on the first floor. Some of the things we're working on, and that's after you go past the Welcoming Center, is a new and expanded blood draw center. It's just definitely been too tight back there. We're relocating some of our specialty clinics. We're adding a whole new women's health clinic. And it's going to be nice in the fact that it's all for our women, but also creates a state path for them to travel from the main entrance into this new facility. So these folks will have their kind own of entrance and into their own clinic. And so we're really looking forward to that. But we're working through that right now. If you come into the main facility, you'll see where we're starting to shuffle things around and create these new spaces, again, in order to meet the needs of our veterans. So going forward, there's a couple things I wanted to share with you all going forward, because it's truly going to make an impact, at least in the fall. We actually, we have new guidance that came out that really it kind of impacts from two perspectives. The first is a flu shot is going to be crucial this year. It's very hard to tell the difference in many cases between COVID and flu, but it's essential that we have that. So we actually have the testing capabilities, but we're going to strongly encourage people to, veterans and employees. Actually, for the first time, employees, it's going to be a mandated expectation, which is pretty much consistent with the private sector. But we're going to mandate it, and pretty much unless there's a couple medical conditions or a strong religious belief, for the most part, all of the employees, all the healthcare personnel, whether they work here on site or they work at home, will be required to have a flu shot. But we're really strongly encouraging this for our veterans. We were ordering more vaccine. We're going to look at having an increase our access to the flu vaccine. We're going to have drive-by vaccine shots and just different things like that in order to help people meet the need, because we know there's studies that are starting to say that if you have a flu vaccine, that it helps if you get and end up getting COVID. It will actually help in reducing some of the symptoms or the outcomes, or improving the outcomes. So we're truly this is going to be a national push. It's going to start in mid-September. It's going to have a quick turnaround time. And we're just going to be looking for different ways to meet the needs of our veterans and get them their vaccines, and all of our healthcare providers or personnel. So really, I just want you to understand where we're coming from. We're a high expectation. You might be asked several times, but hopefully we'll get to the point where we'll have, greater than 90% of personnel and veterans vaccinated and have an impact. Just so you know, this facility does have the ability to test for both flu, influenza A and B, and for COVID. And so our secretary has asked us to be strong, to build up those supplies so that we can be quick to meet the needs of veterans, whether they have flu or COVID or both, or whatever it might look like when we go forward. A couple other things too, just going forward, we're going to be adding specialties down to our Toledo CBOC area. So if we felt that that's a place that's underserved, it's interesting when we would send our veterans out who didn't want to travel to Ann Arbor, say for a cardiology or neurology appointment in Toledo, we'd send them out to the community. But unfortunately, either the community didn't have capacity, or they'd still end up having to drive a good distance. So we've decided that we really need to meet the needs of our veterans there and add a few specialties. It appears to be a bit of an underservice. So we've been working with the University of Toledo Medical Center, and we're bringing on cardiology, urology, neurology, chiropractic here in the near future, and dermatology, just so that we can meet the needs of our veterans closer to home, in addition to all the virtual assignments we're doing, in addition to the VVC. We're hoping that this will help support veterans closer to home. I want to tell you through this time frame, we have been very fortunate as a healthcare system. We solicit from you all feedback on how we're doing, and you give us feedback. And I will tell you, it's great because we take it, we incorporate, we learn, and we try to improve the way. But right now, the VA is significantly improved in their trust factor at a 92%. And so many folks are really appreciating what we have to offer, and they're giving us feedback, giving us opportunities to correct if we need to correct, but also giving us feedback if we're doing things well. So just want to share that we're really, even during all these hard times, the veteran experience is still moving in a positive direction. The only other thing I would, as I already indicated to you, we tend to work as a market and support our veterans wherever they might be. We have actually are all regularly meeting together, regularly looking at different ways that we can support our veterans. As I kind of alluded to before, when we had to close our community-based long-term care here in Ann Arbor, the folks in Saginaw and the folks in Battle Creek took those patients for us and treated them sublimely. And then they, on the other hand, they sent us their patients that needed to be seen and wanted to be seen in the VA healthcare system. So we continue those relationships and are just really outreaching to see how we can meet the needs of our veterans as a market, and just get to all your needs that you might have. And I will say though, we're still providing services in the community, but just like everybody else. This is just some of our financial work and the number of consults we're getting. Just like everybody else, in 2020 is the gray line. You can see there in April and May, it took a significant dip because we weren't providing those services, or not the services, like a lot of the surgeries were being deferred if they weren't urgent and emergent. But as you can see, we're doing an uptick there, and as we are here with our workload to meet the needs of our veterans. And still, again, trying to provide the care closest to home whenever we can. So I just wanted to take this time to share with you what's new, what's going on with the VA healthcare system here in Ann Arbor. I truly appreciate this opportunity. I wish I could be there with you and have an open dialogue and answer a few questions. But I really appreciate you allowing me to come and present, share with you what's new and what's coming here at the VA Ann Arbor healthcare system, and just the opportunity to provide services to you. I have been in VA healthcare going on about 28 years, and I stay because I love my mission, and I know what my mission is every day, and my mission is to serve veterans, and it allows me to get in there and just kind of improve the whole experience for everyone. So thank you again, and you have a great day.